Here's a detailed explanation of glucagon. Medic Glucagon Comprehensive Overview 1. Generic name, drug class, drug forms, brand name. Generic name, drug class, hormones, hyperglycemic agents, anti-hypoglycemic agents, antidotes. Drug forms, powder for solution, reconstitution, for injection, for IM, SC, or IV use, prefilled syringes or auto-injectors, nasal powder, common brand names, Glucagon, injectable, Gvoke, liquid stable, prefilled syringe or auto-injector, Baqsimi, nasal powder, Glucagon emergency kit. Glucagon is a polypeptide hormone secreted by the pancreas. As a medication, it is used for the emergency treatment of severe hypoglycemia in insulin-treated diabetic patients. It also serves as a diagnostic aid for imaging procedures involving the gastrointestinal tract by relaxing smooth muscles. SHAT3, mechanism of action. Glucagon acts by stimulating 1. Hepatic glycogenolysis, converts glycogen stored in the liver into glucose. 2. Gluconeogenesis, promotes the synthesis of glucose from non-carbohydrate sources. 3. Gastrointestinal smooth muscle relaxation, used during GI imaging to slow motility. Process, binds to glucagon receptors on liver cells, activates adenylate cyclase, increases CAMP. CAMP activates protein kinase A, stimulates enzymes that break down glycogen. Glucose is released into the bloodstream, increases blood glucose levels. 4. Indication, FDA-approved uses. Severe hypoglycemia in diabetic patients unable to consume oral glucose. Diagnostic aid during radiologic exams of the GI tract, e.g. stomach, small bowel, colon. Off-label uses, beta blocker overdose, calcium channel blocker overdose, reversal of anaphylaxis in patients on beta blockers. 5. Contraindications. Known hypersensitivity to glucagon or its excipients. Pheochromocytoma may provoke massive catecholamine release, hypertensive crisis. Insulinoma, risk of rebound hypoglycemia. Patients with glucagonoma, rare pancreatic tumor. 6. Before taking this medicine, precautions. Medical history, adrenal gland tumors, pheochromocytoma, pancreatic tumors, insulinoma, history of hypoglycemia unawareness, liver dysfunction, may affect glycogen storage, heart disease, glucagon may increase heart rate and BP, pregnancy and lactation, use only if clearly needed, classified as Category B, allergies, report any known allergies to glucagon or lactose, used in nasal powder. Educate family members or caregivers on proper administration. 7. How to use. Injectable form, Glucagon Gvoke, reconstitute powder if using Glucagon kit. Administer 1 mg intramuscularly or subcutaneously in the outer thigh or upper arm. Turn the patient on their side post-injection, risk of vomiting. Nasal form, Baqsimi, insert into one nostril and press plunger to deliver dose. Works without inhalation by the patient, suitable for unconscious patients. Post-administration, once awake and alert, give oral carbohydrates, juice, glucose tablet snack. 8. Dosing information. For severe hypoglycemia, adults and children 25 kilograms or 6 to 8 years, 1 milligrams, IM, SC, IV, or intranasal once. Children 25 kilograms or 6 to 8 years, pain and Shasta 0.5 milligrams, IM, SC, IV, or ideologic use diagnostic aid. Adults 0.2 to 2 milligrams IV depending on procedure. Pediatric, adjusted by weight and procedural needs. Misdose overdose. Misdose, not applicable in emergency situations. Overdose, symptoms, nausea, vomiting, hyperglycemia, hypokalemia, hypotension, rebound hypoglycemia. Management, supportive care with IV fluids, monitor glucose, electrolyte balance. 10. Stop or avoid taking, discontinue immediately if signs of severe allergic reaction occur, anaphylaxis, diagnosis of insulinoma or pheochromocytoma confirmed. Avoid multiple doses unless under physician supervision. Do not use if solution appears discolored or expired. 11. Side effects in detail. Common, nausea, vomiting, injection site pain, headache, dizziness. Less common, sweating, fast heartbeat, tachycardia, rash or mild allergic reaction. Serious severe, anaphylaxis, rebound hypoglycemia, especially in insulinoma, hypokalemia, hypertension crisis, in pheochromocytoma, pulmonary edema, rare. 12. Vital information. Always store injectable glucagon in the refrigerator until needed. Nasal glucagon at room temperature. Ensure caregivers are trained in emergency use. Call emergency services after administering glucagon, even if the patient wakes up. Do not mix with insulin in the same syringe. Check expiration date frequently and replace outdated kits. HATA 13. Other drugs will affect. Potential interactions. Beta blockers, e.g. propranolol, may intensify heart rate and blood pressure response. Indomethacin may inhibit glucagon-induced hyperglycemia. Insulin opposes glucagon, delays its glucose-raising effect. Anticoagulants, e.g. warfarin, risk of bleeding from IM injection. Thank you. Have a nice day.